Unfortunately, as we all know, Australian men and women do look 10 years older than their European counterparts. Now, how is that so? Well, it comes down to one major factor, and that's the sun. The most simple thing you can do every day is to avoid excessive ultraviolet exposure. Unfortunately, for most people, by the time they've come to realise this or come to see me, they already have significant sun damage. That just goes part and parcel with our lifestyle in Australia. The great outdoors is encouraged and is part of nearly everybody's life. Now, the most important thing you can do is use a sunblock every day, a good quality sunblock that contains zinc or titanium dioxide. These products will prevent ageing, but unfortunately for a lot of my patients, the ageing process has already started. So despite our knowledge and all the preventative steps we can take, there is still damage that gets through, and there are things you can do to keep you looking your best. These can be something as simple as a microderm abrasion or a peel. What this does is it encourages cell turnover and can help deal with pigmentation. There are other treatments such as LED lamps, which can also help stimulate regrowth and regeneration of the dermis and epidermis. These are simple, minimally invasive things you can have done in your lunchtime in my clinic to give you great looking skin. A question I'm often asked is it possible to turn back the signs of ageing to reduce the effects of the sun? And for most patients, yes, it is possible to make a substantial improvement on their appearance. Smoking is another issue which my patients don't often recognise or understand, also speeds up the ageing process. So the combination of smoking and sun exposure leads to photo-damaged and aged skin. Now, the combination of stopping smoking and using a sunblock is not enough to turn back the damage. It certainly is a great step forward, but there are other things you can do. There are products that I can recommend for you to reverse the signs of ageing. There are two broad categories. One are the anti-wrinkle injections, which are useful for the areas around the eyes and forehead. It's an extremely safe and common procedure, suitable for people once they've reached their 30s and 40s. Two of the key areas in ageing are wrinkle formation and loss of volume. Now, wrinkle formation can be addressed with anti-wrinkle injections such as Botox. However, if the wrinkles are what we call static and present when you're not expressing any emotion, then it's time for filler. Now, a filler is a completely natural product. It's hyaluronic acid, which is the same substance which is found in joints and cartilage. It comes in different consistencies and is a very useful tool in preventing the signs of ageing. As a plastic surgeon, I've had ideal training and expertise in facial anatomy. This means that the placement of Botox is done sympathetically and anatomically to leave you looking refreshed and natural, so that even your best friends don't realise you've had the treatment. Likewise with fillers. It's all about facial harmony and balance. I'm ideally placed to be able to consult with you and discuss with you what your options are to achieve and restore facial harmony, which has suffered as a result of the ageing process.